and guests of the occupants of retirement homes, long-term care homes, and other congregate care accommodations when they raise concerns about their loved ones' living conditions.
Mr. Harden has moved private member's notice of motion number 56. Pursuant to Standing Order 101, the member has 12 minutes for their presentation.
Thanks, Speaker. As I start, I want to thank my friend from Chatham-Kent for the eye contact there, and I want to thank my friends at the clerk table for that helpful advice as we began. I launched right into debate, Speaker, because this is a matter that hits me right in the feels, right in the heart. Because as the province's disability critic and accessibility critic, I've had the good fortune to listen to families from across the province, not just where I'm from in Ottawa Centre. And I think we have an opportunity today to send a real beacon of hope out to a lot of them. I want to acknowledge some people who are watching right now before I get into the substance of the issue, Speaker, about why this motion is important for us to support as a legislature today. I want to acknowledge Maria Sardellis, who's watching us right now from the great area of Nepean and in Ottawa. I want to thank her and her mom Voula for their support. I want to acknowledge the Sege family in Cornwall, Joy, Vic, Uncle Felix, and Andre. Andre, I hope you have your iced cappuccino going. I was told you did. I want to acknowledge Maureen McDermott, who's watching this from Sutton, Ontario, who's been an absolute tower of power, Speaker, in standing up for folks at the Riverview Glen long-term care home. Why is this motion before us, Speaker, and why do I think we should pass this unanimously, send out a beacon of hope to the province? Because, unfortunately, Speaker, we've had a situation in the province of Ontario where practices have not kept pace with law. What do I mean by that? I mean, in a situation where one is in a position of offering volunteer family caregiving love to someone in a care home, whether it be a long-term care home, a retirement home, or a group home, invariably sometimes there will be disagreements about the conditions of care for that loved one in that home. Right now, the law is very clear. Residents of those care homes have a right to see those family members. They have a right as occupants of those care homes to see those family members. But unfortunately, and I want to emphasize this, Speaker, for the record, for a minority of home operators, who in my opinion do a disservice to the entire sector, this minority of home operators, Trespass to Property Act notices have been issued at times to family members who've registered meaningful, informed complaints about the living conditions of their loved ones. What this amounts to, Speaker, is a sledgehammer in a delicate situation that requires thoughtful, consultative leadership that most care homes practice. But you can imagine the chilling effect that happens when you worry about whether your complaint about your loved one's living condition in a home could amount to you getting a letter by registered mail or an email telling you you're no longer welcome in the home because you've committed an act that is not conducive to the home being a respectful workplace or a respectful place for residents in which to live. This is what happened to Maria Sardellis in Nepean. She's a fierce advocate for her mom, Voula, who lives with dementia. She's 98 years old right now. And I found out about Maria's story, about Voula's story, through a great newspaper in our city, the Ottawa Citizen, that talked about what happened to Maria. If you can believe it, Speaker, she was separated from Voula for 316 days. Missed Voula's birthday, missed Christmas, missed Thanksgiving. And why? Because there was a dispute about whether or not an external caregiver Maria had hired to go help Voula could get into the home. The home operator said no, and Maria couldn't be there all the time, Speaker. She wanted that caregiver to get access and get in. So a dispute presided, and the home rendered the opinion that it rendered, and 316 days later, no resolve happened for 316 days, and it was deeply, deeply unfortunate. The same thing happened to the Sege family in Cornwall, Speaker, where their son, Andre, hi Andre, was living in a group home because Andre needs that 24/7 care, needed that 24/7 care, that help. And when the Sege family had registered complaints about Andre's living conditions, unfortunately, this is what happened to them too. Trespass orders, disputes, not conducive for anybody's mental health, anybody's physical health. And ultimately, if you can believe it, Speaker, Andre was evicted from that group home, unceremoniously brought back to his family's front doorstep, his possessions beside him in a garbage bag. Can you imagine? This is the province of Ontario. I want to talk about Marie McDermott, who was separated for 106 days from her mom. 106 days, Speaker. And this isn't just any family caregiver. This is someone who is the president of the family council in this institution. She volunteered so much to make that home better. And this is what family councils do across the province of Ontario, I think across this country, is they work to provide great civic life in care homes, because care homes are supposed to be joyful. They're supposed to be places where people can live, and have fun. And when disputes happen, play that role of smoothing things out. But that did not happen to Maureen. So every single, and there are many more I could talk about, Speaker, every single caregiver I've talked to has said the same thing to me. Joel, anytime any one of these cases ends up in a court, the court is very clear. You can't do this to family caregivers. The Trespass to Property Act is not meant to be used in this way. We need to have a sledgehammer taken out of this scenario, right? We need to enforce good operative practices. And quite frankly, used to teach legal studies at Carleton University, Speaker. Putting my legal studies hat on for a second, I can point my friends in government to several statutes that confirm the rights that I'm talking about here. The Trespass to Property Act is very clear that a person can only be trespassed if they do not have legally conferred authority as a POA or as a substitute decision maker. If the occupant wants them in, they have a right to be there. The Retirement Homes Act of 2010, Speaker, Section 51, subsection 9 stipulates that residents have the right for his or her lifestyle and choices respected to freely pursue their social, cultural, religious, spiritual, and other interests insofar as that resident's lifestyle, choices, and pursuits do not substantially interfere with the reasonable enjoyment of the home for all usual purposes by the licensee and other residents. So there's a balancing act, Speaker, but it's very clear that it's there. The Ontario Human Rights Code says the same thing. Tenants of care homes have the right to decide who they want to invite into their home, just as homeowners do. And if the landlord tries to control who can visit the tenants, this can be considered harassment. The Residential Tenancies Act of 2006, Speaker, Section 22, protects tenants' rights to the full enjoyment of their property. Section 23 of the same Act prohibits landlords from harassing, obstructing, or interfering with the tenant. The Ontario Landlord and Tenant Board, Speaker, addresses the landlord's restriction on tenants' visitors as a violation of rights by referencing Section 4 of the RTA, which essentially operates to make clauses in a lease restricting these rights as null and void. I could go on, Speaker, there's more, but I just wanted to emphasize for the record that these rights are endowed. They're here. Our grandmothers and grandfathers worked hard in this place to affirm them. But the problem is most people don't know they have these rights. And when the worry or threat of a trespass to property order is issued, it's enough to cow people into just acceding to whatever the request is, to looking the other way. But I can tell you right now, Speaker, across this great province, there are caregivers right now in that wretched situation. You sense something's wrong, you want to do something about it, but you fear repercussions. You fear repercussions for your visitation rights, for your loved one in the home. I can tell you, when Maria Sardellis mustered up the courage to defy a Trespass to Property Act on that 316th day of separation from her mom, Voula, she called the Ottawa police the day before, and she told the person on the other end of the line, I'm going to be defying this order, but I don't think it's a lawful order. I'm not going to put up any resistance, but I think what's happening here is wrong. Police were called, charges were laid. Guess how long, Speaker, it took for a judge to throw this out of court? 20 minutes, gone. The judge says, what's this doing in my courtroom? What is this doing in my courtroom? But I asked the question, Speaker, how many other folks have gone to that extent? And why do we put family caregivers in this position in the first place? So I have some reason for hope, Speaker, and we shall see it in the debate. We shall see it in the debate. But my friend, the minister responsible, I've been the critic for as long as I've been the disabilities critic, the Honourable Raymond Cho, and I have talked about this, talked to his chief of staff, Michael Thomas. I know conversations are ongoing in the government about this. But if today we can clarify Voula's law, what we're calling Voula's law, it's a motion, Speaker, but we're calling it Voula's law, is something we all agree on, that trespass to property orders should not be issued in circumstances like this, I think that would dramatically empower the process underway at the government level, however you decide to take it. And you'll send a message out to this whole sector that we see the family caregivers and we value them. And can there be a more important time to send that message than right now, Speaker, in this pandemic? I mean, haven't we been reminded about how important that voluntary caregiving has been to keep people's lives meaningful? When we had that awful moment of the pandemic when people weren't allowed in because folks were trying to keep people safe, and you saw immediately how that really impacted care, how that really impacted residents. So this is a moment where we can actually come together. It's happened before. We've had the Poet Laureate Bill in the memory of Gord Downey pass here. We've had my friend from Toronto St. Paul's Eating Disorders Awareness Week, private members bill passed. I want to hold out hope that this is another moment where we can come together, regardless of our political stripe, and agree advocating for a family member is not a crime. It's not a crime. We all do it. We do it through our whole lives. We do it for our kids in public school. We'll do it for our elders in retirement homes. We'll do it for our family members in group homes. And we have to figure out a way in which that advocacy can happen so it's constructive. In a way, I'll end on this note, Speaker. It comes back to encouraging a certain kind of leadership. I know there are some folks out there that think you have to be firm and you have to be clear and you have to, when you hear dissent, you just got to tell people where to go and how to get there. I just want to tell folks who believe in that kind of leadership, you're just courting trouble, because you're going to find a Maria one of these days. You're going to find a Joy one of these days. You're going to find a Maureen one of these days who's going to stand up and challenge you. Let's find a way to resolve conflict, Speaker. That's what this motion is all about. Thanks.
Thank you very much. Further debate. I recognize a member from Richmond Hill.
Thank you, Mr. Speaker. It is my honour to rise today to speak about motion 129 raised by the member for Ottawa's Centre. Mr. Speaker, our government believes that health and wellness and well-being of our congregate care residents, their families, and the frontline workers who keep them safe must always guide our actions, and we care about them. This principle has guided our actions during the darkest day of the pandemic, and it will continue to guide us as we see the light ahead of our province. Our government took decisive action to require our retired homes to follow the direction and guidance of the Chief Medical Officer of Health, something that has been in place under the Liberal government. We have consistently stepped in with the supports needed by the congregate care settings across the province to help them meet the local needs in our communities. We know that if we prevent the COVID virus from entering our homes, or if we can catch it as early as possible, we can help significantly curtail its impact on our most vulnerable populations, including our seniors. To help our retirement homes keep our residents safe, and the government has provided the significant investments in additional infection prevention and control and personal protective equipment supports. We have engaged with our partners, including the Ontario Retirement Community Association, to help flow these funds quickly and effectively to where they can do the most good. I want to take a moment to thank the ORCA for being a great partner for us in helping to keep our seniors safe, the families and our frontline workers working together to keep everybody safe. COVID-19 is a tough enemy, Mr. Speaker. But when we act together as our one team, Ontario will involve each other and our partners across the province, and when we are together, we are tougher. COVID-19 has helped to remind us that the importance of the community, of our duty to help those to stay isolated, to connect into our society, to remind them that we are all in this together. The last year has been difficult for many Ontarians. It has been particularly difficult for our seniors. You and me feel it the same way, and we have been working very, very hard for our seniors. Many of our seniors has isolated and to stay at home or stay safe from the COVID-19. Mr. Speaker, this is why our government has introduced as many programs to help our seniors to stay connected into our communities. Programs like the Senior Centre Without Walls program, which I participate and has been acting with our community and the different organizations. We have funded the Seniors Community Grant Program, the Ontario Community Support Program, and the Inclusive Community Grant Program. All help our seniors to stay connected. And I'm sure you have experienced the impact and the creativity and the support they have given to our seniors. Our government has responded to the pandemic by addressing both the immediate needs of those facing COVID-19 as well as building the long-term supports needed to not only allow us to survive, but to thrive as we exit from the pandemic. Building our long-term supports for our seniors involves turning a critical eye to the systems that we already have in place, looking for opportunities to enhance, replace, or rebuild as needed. This is why we asked the Auditor General to report to the Retirement Home Regulation Authority and the work of the Ministry for the Seniors of Accessibility in keeping our seniors, their families, and their loved ones.
Excuse me. I have a point of order from the member from Davenport.
And apologies to the member for interrupting, but I don't believe we have quorum in the chamber.
Quorum is not present.
Quorum is not present.
You just harmed your own member.
At 12 now.
To say, and I say this is why we asked the Auditor General to report on the Retirement Home Regulatory Authority and the work of the Ministry for Seniors and Accessibility to keep our seniors, their families, and our tireless frontline workers safe. The report was received from the Auditor General will help inform our Retirement Home Act review. Mr. Speaker, so does the topic raised by this topic how the Trespass Act intersects with our congregate care settings. Our government stands in favour of this motion. I hope my member will be very happy that we are seeing things in the same way, because we care for our seniors. The seniors is something that we have been speaking, that we not just talk about it, we put that into action. Now, this is a government of transparency and accountability, one that believes, above all, the services and supports must be delivered for the people. We will continue to build out the systems and supports and meet the unique needs of the Ontario's seniors. They are the fastest growing segment, and I'm sure you know that our population with over 100,000 joining the ranks of our seniors every year. This is why government, under the leadership of Premier Ford, delivered on our promise to create the Seniors Dental Care Program. Through our $90 million annual program that we're able to provide better access routine dental services for the seniors. As I say, we are putting things into action. To help provide access to these services, we also invested $25 million last year through the Seniors Dental Capital Program, expanding facilities in underserved areas across the province. This is the promise that we have made and the promise that we have kept, Mr. Speaker. It is one example of the strong system and supports we are building for the seniors and all Ontarians. Soon, our Minister of Finance will deliver a provincial budget as well. He has been tirelessly advocating not only for the residents of Pickering Oaksbridge, but for all Ontarians. And it is exciting to share with the people of Ontario that the next steps in our continued and evolving system of the support for the seniors is also underway. Our seniors has helped to build the province, Mr. Speaker, exactly as what the member opposite has been mentioning. We care for them. From the very beginning, we say that they build this province, and we're here to honour them, respect them, and work with them and their loved ones to make the years that they are going to continue to share in this earth to be a very enjoyable one. Our government stands with them. They have stood by the province. It is time that we do and serve them in the greatest need. As I shared initially, Mr. Speaker, and as our government has consistently and continually shared, our government stands firm in this commitment to protect the health and safety of our retirement home residents, their families, and the tireless frontline workers. We appreciate the efforts of all those who continue to work tirelessly to protect our vulnerable in the retirement homes, in our congregate care setting, and all across the province, especially in the long-term care. Protecting Ontarians involves partners in all levels of government with the support of the community organization, businesses, and interested individuals all across the province. Through the continued implementation of our vaccination plan, we continue to move together towards a brighter day ahead. And together, we will survive this pandemic, and we will come together as we emerge healthier and stronger as a province. We're looking forward to work together with everybody in this province for our seniors. Thank you, Mr. Speaker.
Thank you very much. Further debate, the member from University Rosedale.
Thank you, Speaker. Thank you to the member for Ottawa Centre for bringing forward this very important motion that I know speaks dearly to residents in Ottawa and also your own work. Very simply, this motion aims to make it clear that there's clear direction to operators that the Trespass to Property Act does not permit them to issue trespass notices to loved ones and guests and family members of the occupants of retirement homes, long-term care homes, and other congregate care accommodations when they raise concerns about their loved ones' living conditions. It makes a lot of sense. It shocks me that this needs to be debated so that the law is actually enforced, but I fully support this motion because it is absolutely necessary. I have spoken to Mary Sardellis, the MPP for Ottawa Centre, put me in touch with her, and I was also shocked by her experience by simply doing the job that any single one of us would do to make sure that her mother, Voula, receives the care that she deserves in the City View retirement community that she was currently living in. The fact that she was charged is shocking. But why I bring up this issue also is because it also speaks to the testament of the power of having one woman stand up and say, no, 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 this is not going to happen, and I'm going to make sure that it doesn't. And it also speaks to the testament of what an MPP can do when they reach out and support a constituent in their riding to make a difference. And it is also a testament to what happens when an example, a specific example, which is what is happening in this case, is also a reality that is shared by many loved ones and occupants of long-term care homes and retirement homes across Ontario, because that is exactly what this is. It is not an isolated incident. It happens all across Ontario. And it's an issue that has long been fought for by the Advocacy Centre for the Elderly, a legal clinic in my riding, who has continued to be concerned about the abuse of this power and has raised this issue many times. And it is good to see their support for this motion. Every single family member has the right to visit their loved ones in long-term care and retirement homes following all public health rules and protocols. And family members also have the right to tell the truth if they see substandard, cruel, inhumane conditions and neglect. That is what Mary did, and that's what every loved one should be able to do as well. I fully support this motion. It is part of our long-term campaign to improve the living conditions of people who live in retirement homes and long-term care homes. It needs to be augmented with the many bills and motions that we have introduced and will continue to fight for. That include taking the profit motive out of long-term care. That include ensuring that every single resident has 4 hours of long-term care from a qualified personal support worker so that they can get the care that they can deserve, and also to support MPP Gretzky's bill, the More Than a Visitor Act, which gives essential caregivers the right to support their loved one. Thank you. It's very good to hear that the opposite side is looking at supporting this motion, and I'm looking forward to seeing it enacted, and so that it becomes the way things happen in every single long-term care home and retirement home across Ontario. Thank you.
Further debate? Recognize a member from Humber River, Black Creek.
Thank you very much, Speaker. And I want to thank my friend from Ottawa Centre for bringing forward this important motion. I think we can all agree that so many of those living in long-term care are our grandparents, our parents, our loved ones, people who have spent an entire life dedicated to raising us, giving us everything we have, building the society around us, and in their time of greatest needs, we must be there for them. We must give them the dignity they deserve. It is an absolute priority. Before and during this pandemic, we've all heard from too many families worried about their loved ones in long-term care. We've seen far too many family members line up outside of long-term care homes experiencing outbreaks, worried about the conditions their loved ones were living in. We've all read the horrifying military report which exposed cruel and inhumane conditions in 5 private long-term care facilities, including at Hawthorne Place in my community, after years of neglect by previous governments. Now imagine you find yourself in a situation where you are visiting a loved one in a congregate care setting. It could be your mother, your father, your aunt, your uncle, or even a close family friend. And you witness that they are not living with the dignity they deserve. And when you file a complaint about your loved one's conditions, instead of having the matter addressed, you get a no trespass order, meaning that you are unable to see your loved one and are unable to advocate for their care. As the member from Ottawa Centre pointed out in his remarks, Mary Sardellis found herself in this very position because after she filed a complaint about the conditions that her 98-year-old mother, Voula, had been living in her retirement home, rather than improving her mother's living conditions, the retirement home used the Trespass to Property Act to ban Mary from entering the premises. Because Mary blew the whistle about conditions in the retirement home, Mary was not able to see her mother for almost a year. The Advocacy Centre for the Elderly says using the Trespass to Property Act to separate seniors from their families is not only cruel and inhumane, it is illegal. Jane Matus, a staff lawyer and institutional advocate for the Advocacy Centre for the Elderly, has said they receive at least one call a week from people who were served with a trespass notice and prevented from visiting their loved ones. Again, their parents, their grandparents, people that they love. And when they're concerned and they're trying to come in to help them, they are served trespass notices. This is the response of some of the retirement homes. Speaker, I've heard from residents in my community who were afraid to speak publicly about the conditions their loved ones have experienced in long-term care, out of fear that they or their loved ones could potentially face retaliation. It's terrible. Living in a congregate care setting is already lonely. Imagine the further mental anguish many seniors will face, and many others, if they are prevented from seeing their loved ones. I'm proud to support Voula's law, and it is my hope that this motion passes unanimously so that families can have peace of mind that they will not be separated from their loved ones just for advocating on their behalf. There's so much that needs to be done to fix LTC in this province, and certainly this excellent motion put forward by my friend is one of them. Thank you.
Thank you very much. Further debate, member from Davenport.
Thank you, Mr. Speaker, and good afternoon. I want to thank the member for Ottawa Centre for bringing forward this motion and for continuing to raise this issue on behalf of his community. I am so proud to rise on behalf of my constituents in the Great Riding of Davenport to support this motion and to urge the government to put aside partisanship and do the right thing. As we have heard, this bill was prompted by the shocking story of Voula Sardellis, who was kept apart from her daughter for nearly a year. The Ottawa retirement home where Voula lived used the Trespass to Property Act against her daughter Mary, or Maria, in what clearly appeared to be retaliation for raising concerns about her mother's care. Voula and Mary's case is disturbing. I think we can all agree on that. But we know it is also not an isolated incident. In fact, we really don't know how many other times this has been used, but the member from Ottawa Centre did share some other examples, and that is why this motion is so important. We need the provincial government to provide clear direction to operators of retirement and long-term care homes not to abuse the Act in this way and to respect the rights of residents to see and be cared for by their family and essential visitors. Speaker, I really don't have time in my remarks today to fully articulate the impact that this pandemic has had on our elders. The loss of life has been staggering. I would argue the negligence in protecting them has also been such. But beyond the immediate risk that seniors faced with this virus, the methods to protect them have had other impacts. Increased isolation, a loss of hands-on care as staffing levels were strained, and prolonged separation from family members. I have heard myself from many, many essential caregivers in my community who've had to become full-time advocates on top of their work as a caregiver, and not just during the pandemic. This is all the time. And that just even to maintain access to the homes. It's why my colleague, the member for Windsor West, tabled the More Than a Visitor Act to recognize the role of essential caregivers. But I want to be clear. While a lack of consideration in policy or overburdened staff led to barriers definitely in this moment for essential caregivers, what this bill seeks to protect them from is a barrier deliberately put in place to discourage whistleblowers. If there is one lesson that we need to take, I believe, from this crisis, from this global pandemic, and from all of the lives that have been lost, it must surely be that we cannot find ourselves in this place again. We must learn something. With the government, leaving some of these outfits, I would argue, unchecked, we need to make sure those inspections are happening, that they're comprehensive before the pandemic, during the pandemic, after the pandemic. But really what we've seen for years now is that it's families that have been left to raise the alarms. And the evidence is completely clear. We must ensure that we are protecting those family members, not just in providing that direct care, because it's the humane thing to do, because it's the right thing to do, but because they are the folks that will often be the ones who will raise the alarms, who will point to the issues, and we need to know what's happening if we're going to make things better. Speaker, I am extremely proud of my colleague for doing something about it. I encourage all members here to support this motion that's before us, and for the government to act swiftly to ensure that what happened to Voula and Mary and so many more is never repeated. Thank you.
Thank you very much. I don't believe there's any more debate on this particular issue. Therefore, I will now turn to the member from Ottawa Centre. You have 2 minutes for reply.
Thank you, Speaker. Well, I had some friends who've coached me along my life tell me there would be moments like this in politics where people could come together, and I've already seen it, as I said, in the sitting of the Parliament. And this is great. It is great to see us come together and acknowledge these fundamental rights, because we can build on this. But I want to be very clear. I wouldn't be here, we wouldn't be here as parliamentarians even talking about this were it not for the courage of Maria Sardellis, were it not for the courage of the Seguin family, were it not for the courage of Mary McDermott and all of those folks. This is about them. This is about them. And the message in politics in 2021 I take from this, for my what will be emotional ride home to Ottawa, is organizing makes a difference. Never, ever doubt that getting together in your community to advocate for change can work. And folks are watching this right now. We've had hundreds of people sign our online petition. Bless every one of you. This works. Don't forget. Don't give up hope. It's so easy to give up hope. It's so easy to become cynical and to dismiss the idea that you can affect change. But tonight, we're seeing it, Speaker. We're seeing it. We can come together. We can honour the legacy, as my friend MPP Way said, of our elders who built this place, as so many of my colleagues have said, and we can actually work right now to build a better world. It is not pie in the sky. It is possible. But thank you, Mary. Thank you, Joy. Thank you, Maureen. Thank you, all of you good-intentioned troublemakers out there. This night is for you. Voula's law is for you. And Voula, I wore my blue tie for you. Okay, people around this place know I don't always like to wear ties. But this is for you, Voula. This is for you. And let us remember, maybe from here forward, Speaker, let's have more of these moments before we're done in this Parliament. Thank you, colleagues. Thank you very much.
The time provided for private members' business has expired. Mr. Harden, forgive me, I don't have my glasses on. I'm fine. I think I'll be all right. I hope so. I hope so. Forgive me. Mr. Harden has moved private members' notice of motion number 56. It is the pleasure of the House that the motion carried. Carried. All matters relating to private members' public business having been completed, this House stands adjourned until Monday, March 8th, 2021 at 9 a.m.